Let's go ahead, and our special guest has arrived, Acting Secretary Mario Treto. So I think we should go ahead and get started to be respectful for his time. First off, on behalf of IPHA and ICHP, I want to welcome everyone to the 2022 Illinois Pharmacy Legislative Week. Thank you for joining to learn about some important legislation in the state of Illinois that impacts patients and the practice of pharmacy in the state of Illinois. You've got, I can let Garth, if you want to introduce yourself.
Sure. Garth Reynolds, Executive Director of the Illinois Pharmacists Association. And again, welcome to this evening's briefing program.
And Liz, I don't know if you want to introduce yourself as well.
Sure. I'm Liz Brown-Reeves, and I am the lobbyist for the hospital pharmacist. And good to see everyone tonight.
And my name is Chris Crank. I'm the Executive Vice President for the Illinois Council of Health System Pharmacists. And so I think at this point, Secretary Treto, if you would like to go ahead, welcome and thank you so much for coming to give us some updates in terms of what's going on with the Department of Financial and Professional Regulation.
Great, thank you, Chris. Appreciate the warm welcome, and it's good to see some familiar faces. Hello, Garth. Hello, Liz, and hello to all of you that are joining with us tonight. So, when I was given the opportunity to speak to the pharmacists, I was very excited to have this conversation with you because we have a lot of great developments, and you actually are going to be hearing some news for the first time here. So that'll be exciting for all of you. As mentioned, my name is Mario Treto Jr., and I'm proud to serve as your acting secretary for the Illinois Department of Financial and Professional Regulation. Governor Pritzker appointed me in this position April 1st of last year, so we're nearing my 1-year anniversary here at the agency. But I've also been with the agency before that. As you all know, the department consists of 4 divisions. You have the Division of Professional Regulation, which you all fall under, the Division of Real Estate, the Division of Banking, and the Division of Financial Institutions. So we have a lot of things that we're working on at any given time. And prior to this role, I was a director of the Division of Real Estate. As far as the agency goes, we regulate over 1.2 million licensees, over 140 different professions. So it'll be physicians, physician assistants, pharmacists, real estate brokers, cosmetologists, and the like. And we also regulate state chartered banks, credit unions, financial institutions. I was just at the Community Bankers Association of Illinois last night. So it's been exciting to make my rounds across all of the different industry groups and speaking about the updates that we have here with the agency. So as I mentioned, I was the director of the Division of Real Estate, and I was excited to step into this role 3 years ago. Within that role, I oversaw the real estate professionals, and I wanted to make sure that I made a lot of significant improvements across the division. So when I stepped into that role, license processing times for real estate professionals were taking 8 weeks. I thought that was unacceptable, and we quickly worked to kind of deconstruct what that looked like, and now they're taking 3 days. So talk about a way to make individuals have licenses in an expedited manner, making sure that people are able to enter the Illinois workforce quickly and rapidly. And that wasn't the only improvement that we were able to make. I think you all know that as far as the agency goes, we're in charge of licensing, but we also have a complaint intake unit. We do audits, we do investigations and prosecutions. And we do that across all professional regulation, both divisions of professional regulation and real estate. The backlog was that of 4 years, and I again found that unacceptable. And so we were able to reduce audits and investigations backlog by 50%. And with prosecutions, we were able to resolve those and decrease the backlog by 70%. As an attorney myself, I knew the importance it was for us to reduce that backlog, because as licensed professionals, you don't want to have something lingering over your head for a long period of time. I was responsive to that. We did a listening tour across the state of Illinois, and we listened, and we wanted to make sure that we made positive changes throughout the agency, throughout the division. Now that I'm in this role, I'm excited and eager to do the same across all 4 divisions, including the Division of Professional Regulation, which is where you all fall under. We were able to make a significant amount of improvements with respect to diversity, equity, and inclusion. We doubled minority scholarships in the real estate sector by 100%. So we doubled it all, and made again a number of significant improvements across there. I wanted to talk a little bit about my role in the division of real estate, because I wanted to kind of present to you kind of the background that I had within the agency. But prior to that, I was a city attorney up in Evanston, where I drafted over 600 pieces of legislation there with the ordinances and resolutions. So that's been really helpful in terms of legislative proposals and making sure that we're working through and making sure that the industries are moving forward. As you all know, the primary role of and mission of this agency is simple. It's consumer protections. But I also want to make sure that we're moving and advancing industries forward. And that requires a lot of communication, a lot of open door policies. And that's something that I've been really fulfilling my promise with each and every one of you, and ensuring that you communicate with us any concerns that you might have. And I want to make sure that we as an agency address those as well. Because at the end of the day, we're a customer service agency. And I want to make sure that we're responsive to all of your needs. With that, I want to talk a little bit about what we've been able to do since the beginning of my tenure here as the secretary of the department, and then I'll also provide you with significant improvements that we've made that are specific to pharmacists. So. Additionally, outside of my role here, and this is something that I want to mention to this particular group because it ties in with the provision of healthcare services. I was the board chair of a federally qualified health center here in Chicago, and I was the board chair for 4 years. We have 12 clinics, and we also have pharmacy operations in a number of those clinics. And so I understand the critical role that you play. I think that the pandemic has also underscored and emphasized how important pharmacists are. Because in that role, I personally saw patients and how they interacted with their pharmacists. At the end of the day, I believe pharmacists interact more with patients. They see more of that visibility than physicians themselves oftentimes. And that statistic, that fact is very important, and it does not go unnoticed. Again, the services that you provide are really important because not everyone has a pharmacy next door. There isn't a neighborhood pharmacy. So when you talk about the provision of medical care in a way that's equitable, that's where you all play a critical role. I think of you in particular as essential lifelines in the continuum of care. And I think that that's really important to think about as you navigate your professions and as you move forward as a licensee of the agency. So I've spoken a lot about myself. Let's talk a little bit about pharmacists and some of the improvements that we've made specific to all of you. I'm going to give you a preview to the movie a little bit. And so with that, one of the things that we are doing is having a complete overhaul of our technological licensing system and also our website. When I stepped into this role, I looked at the website and it was really difficult to find some information, including, for myself as the secretary. So we're doing a complete overhaul this year. And by the end of the year, I'm hoping that we can unveil the new website. We've already started some of the transition from going to a .com address to .gov. I want to make sure that you all get the information that you need within 3 clicks. I think that that's the industry standard now. So we're working and updating the website and doing that. So the migration is going to take some time. The website is from 1998, I believe. So there's a couple of decades that I need to work on improving that. And that 1998 date actually is not limited to the website, but also the licensing system. So the licensing system is also from the 90s. And I'm looking forward to migrating into a completely new system where you'll be able to check the status of your application, whether it be a first-time application or a renewal. I'm looking at some of these applications that you see available now, where you can track where you are in the process of a request. And so I want to make sure that you're able to see that the application was submitted, it was received, the payment has been processed, and what deficiencies there are. I think that that's a mutually beneficial improvement that will be, again, unveiled hopefully by the end of this year. And it's going to be a phased approach, as if you can all imagine. So a lot of work that we're doing with that. And so I'm working with a lot of different companies to making sure that we'll be able to do that. So a little bit of some insight there that not many have, but again, I'm excited to unveil that. And that actually brings me to a question that I know I was going to receive with this particular group. And I see some people smiling already, and that's the renewal. What do the renewal dates look like? And so you'll be receiving this information before anyone else, but we'll be announcing all of it relatively shortly. So I know that the original renewals were set to be January 1st, 2022 through March 31st, 2022. And so in part of the migration work and part of transitioning a number of different regulated professions from paper applications to online applications, there's been a lot of work that we've had to do kind of on the backside to make sure that everything flows smoothly. With that, I also had to make a couple of changes that reflect the way that we can play a role through the COVID-19 pandemic, but also one of the things that was unveiled through the recent budget proposal by Governor Pritzker. I know that you all are well aware that when he asked our agency in what way can we assist the people of Illinois, as a regulatory agency, we knew that we could play a role with those licensing fees. So I've looked at this upcoming fiscal year, and in looking at the fiscal year, I wanted to make sure that all licensees that were related to the medical professions were captured. So those individuals that have licenses that renew once a year are going to be captured within that time frame regardless. But there are other professions such as pharmacists that don't have an annual renewal. So I had to make a couple of changes, and we're going to make variances made public that are going to outline what the new deadlines are going to be for your respective professions. So with that, I'll make an announcement right now with when your renewals will be opening up. With the opening up section, I'm hoping to have those ready by the end of next week. So I'm hoping to get it hopefully sooner than that, but by the end of next week, we'll be able to open up the renewal timeframe. Now, with respect to the renewal extension deadline, for pharmacies and pharmacy technicians, that's going to be extended through May 31st, 2022. And for pharmacists, that's going to be extended to July 31st, 2022 with the fee waiver. Now, let me explain a little bit about why that is, right? I wanted to make sure that I captured the pharmacists within this fiscal year. So by extending that and having July 31st, 2022 be the deadline, it falls within the fiscal year. So all of the individuals that are going to be renewing, you're going to be getting a fee waiver this year. Pharmacies and pharmacy technicians, you have your renewal is going to be extended through May 31st, 2022. So that doesn't fall within this fiscal year, but as the fiscal year progresses, May 31st, 2023, you will also be getting the fee waiver as well. So everyone will be captured at least one time within this fiscal year. So I'm excited that we're going to be able to move the needle forward and just give you a little bit of a thank you. I know I mentioned a bit about my personal experience within the healthcare world, but I think that it's long overdue that each of you are thanked for what you've been doing throughout the pandemic. I know what it's like as a federally qualified health center former board chair to provide critical care services with limited resources. And so again, this is really important for us to move the needle forward in an equitable fashion, but also assisting each and every one of you in this way. COVID-19 has also allowed us to rethink what it means to practice medicine and be in the practice of the provision of healthcare services during the pandemic. We were able to expand the scope of practice for pharmacists and techs to administer COVID-19 vaccines and COVID-19 tests, and that was particularly helpful. So thank you all for all of you that have stepped up into that role. We were also able to allow for the temporary COVID permits during the pandemic for out-of-state licensed pharmacists, and that has allowed us to provide a lot of critical care services to the people of Illinois. We have a lot of other great developments across the agency, but another one that's specific to pharmacy and to pharmacists is that we just today had the first day of our new deputy director. Our new deputy director is Stephen Smith. He comes from the private sector. And prior to that, he was an investigator with the Missouri Board of Pharmacy, and he's going to be Springfield based. So I'm excited to onboard him onto the team. Today was day one, so it was a hectic day, but I'm excited to introduce him to you in a future event. I think that'll be really exciting. And as you all know, there's a newly created pharmacy technician position on the pharmacy board. And I have been vetting an individual, and this individual is going through final vetting steps. But I'm eager and excited to announce the new candidate that will be representing pharmacy technicians on the pharmacy board. So that's a bit of what's been going on in the pharmacy and pharmacists and pharmacy tech world. Really appreciative of everything that you've done. I can't thank you all enough for all the work that you've been doing throughout the pandemic. But again, just in general, I talked a little bit about how you are an essential lifeline in the continuum of care, and I truly believe that. So I'm excited to see how this year progresses, and I'm excited to see the evolution of the regulation of your respective industries. I think that, again, COVID-19 has allowed us to rethink some of the constraints that we had historically, and we've made a significant stride and significant improvements across the agency to help you all out. So with that, I wanted to keep my remarks brief and answer any questions that you all might have, but I wanted to thank you again for the invitation and for having me here at your conference.
Thank you very much for those, the great comments, Secretary Treto. We really appreciate it, and I think the information you provided was invaluable to us in terms of if you've worked with pharmacists, we're detail oriented and we're very somewhat by the book, you might say, and so
I love it. That's great to hear.
So I do see a couple of questions did pop up in the chat. We have it set up. A lot of people saying just thank you for the information. We really appreciate it. One question is, was the fee waiver, is that for both individual pharmacies as well? So pharmacy licenses, those fees will be waived, or is it just for the pharmacist and techs themselves?
That's a great question. Thanks, Chris. It's limited to individuals. So the fee waiver will be limited to the pharmacists, the pharmacy techs. The pharmacies will not. So it's really a way to help out the actual individual professionals that have been assisting throughout the pandemic. So great.
Perfect. Another, just more people saying thank you, for the update and the information, and thank you for being accessible to us as well, because that's great to hear. As a pharmacist myself, obviously, to hear from you and get that information, to me, it says a lot.
And I appreciate that, Chris. And one of the things that I'm really committed in this particular position, and I think if you look at my history with all my other roles that I've played, I really maintain an open door policy. And I think that through collaboration, we can move the needle forward together. And that's something that, again, I did that in my previous role as a city attorney. I did that in my role as the board president of the FQHC. I did that as director of real estate. And I'm excited to do that now as the secretary of the agency. So each and every one of you certainly has an open door to me. I think it's helpful to work with ICPH and your respective groups to communicate so that there can be kind of a point person that I can work with as we make and implement certain upgrades and certain changes. This isn't the first time, this isn't the last time that you'll be hearing from me. I'll certainly work with all of you as I mentioned, we're going to be making the website updates. We're going to be making the license system updates, and I'll make sure that you are kept informed of every update as it happens real time. Because sometimes I know that the frustrations that people face, in terms of feeling like they're not getting information. Hopefully, if you follow us on social media, I've been very proactive in changing the stance of how we've been interacting with consumers, with our licensees, doing more education, more outreach, events like this, making sure that we're getting our message out so that you all know that I want to elevate IDFPR to another level, and that's a commitment that I have. I know that I'm not going to be in this position forever, but one thing that is for certain is that I want to leave everything that I touch better than I found it, and that's a commitment that you have for me to all of you.
That's awesome. That's great. Thank you. And well, there's a couple more comments about being, happy about the website update, getting it more modernized as well. So that's wonderful.
It was even when I was as a city attorney, when I was looking to join the team and I was asked by the governor to join the administration, I was eager to log on to the website. And I'll be honest with you, there were some stumbling points because I couldn't find certain pieces of information. And if I can't, I'm certain that consumers and licensees probably have the same difficulties. So we've been working at making a lot of different improvements there. So again, if there's information on the website that you find that doesn't apply or is outdated, or you're having a difficult time navigating the system, let me know, because right now we're taking all of that information, all of that feedback, and incorporating it into what the new website and the new licensing system is going to look like.
I'm looking to see, and we want to be cognizant of your time as well. You've already spent a great deal of time with us, which we appreciate. There is the technician certification requirement, the 2 years. This does not have any, does this have any impact on the certification window for instance, NHA or PTCB certification?
That does not have an impact on that. No. So great question. And then I see just clarification for deadlines, just to repeat the deadlines. It's May 31st, 2022 for pharmacies and pharmacy techs, and pharmacists July 31st, 2022, and that'll be with the fee waiver.
Perfect. Well, thank you for all the time. You spend a good chunk of time with us tonight, and we really appreciate all the information. And I think it's great to be able to put a face with the name of the acting secretary of the department. So we really appreciate it.
Thank you again, Mr. Secretary. We really appreciate all your support, and especially with helping modernize DFPR. And we're glad to work with you as those modernizations go forward.
Thank you very much. Thank you, Garth. Thank you, Chris. Thank you, Liz. A pleasure to be with you tonight. And thanks, everyone. Appreciate it. Take care.
Take care. Have a great night. All right, we'll go ahead. I'm going to go back to sharing our PowerPoint, and we'll get reviewing some bills and some other things. So I just want to say, I know people have been joining over time. Welcome everyone to the 2021 Pharmacy Legislative Week, or excuse me, 2022 Legislative Week. And we'll go ahead and move forward. We've already heard from our special guest. A couple of things we're going to do is we're going to briefly, we have a lot of students on the line, maybe people who have not been involved in pharmacy advocacy before. So we're going to talk about how you find out who your legislator is before you have your meetings next week, the logistics of meeting with legislators, some do's and don'ts, and kind of some tips from Liz on the interactions and what you can do to make them better. We'll talk a little bit about the meetings you're going to have with the legislators. We'll do the legislative review, obviously, and then we'll answer any questions that people have at the end of the session. So everybody should have, in the email that they received, there should be the handouts, and these links will be available. We can put this link, it's on the ICHP website, and I believe on IPHA's website as well, there are links to be able to look up your legislators. Typically, the way that they work is when you go in there, you put in your address. So it's actually, this has been revamped. It's a little bit different than it was not that long ago. You put your address up in the upper right-hand corner. And what you will get, I use the ICHP offices because I figured that way, it's nobody's specific address other than the office. And what you can see is it'll actually give you who your senator is for the state. It will give you who your representative is for the state. So that way you can identify who your legislators are.
And Chris,
yes.
Sorry, I would say for these purposes, we are focusing on who your state rep and your state senator are. So congressional and federal folks will come up as well, but we are looking at your state representative and who your state senator are. So that'll be the focus of our meetings and all of the work that we're talking about today.
Thank you. That's an important point, Liz. Thank you. The other thing, it's kind of, again, I like maps, I guess, but you can actually see where your district lines are on there as well. So you can see what type of geographic area that is covered. So in terms of overall, what can you expect from this during legislative week? Well, you're all here on February 16th for the bill review. So we're very similar to when we're live. We're going to go through 4 or 5 key pieces of legislation that have been proposed. And we'll give you the highlights, kind of what it looks to do, what the positives and maybe some of the concerns might be with them. On the back side, for next week on February 21st through 25th, we are working in the background to set up meetings with legislators. So everybody who registered, put in their address, gave us the information. We were able to identify who your Illinois senator and Illinois representative are. And we're going to make appointments. We're going to do the best that we can to try to get time with your legislators. Now, the caveat to that is they're right now, actually, they're having committees and things that go late into the night. So they're having meetings sometimes, at 6 p.m., 7 p.m., they're going late. And so getting their time can be difficult, but we're going to do the best that we can to get those meetings. And anybody,
sorry.
Go ahead.
Sorry, Chris. I was just going to say, so this is, I would call it very crazy time in the Illinois General Assembly due to COVID, due to a shortened session because of a primary. So there's a lot of factors contributing to why things are being done differently this year. If we have not scheduled with your legislator, you will have a chance to join in another group. So some of you will have legislators that will be busy and tied up in committees or non-committal with meeting because of the flexibility of their schedule. A lot of them are nervous to pin things down, but I do know we already have several meetings scheduled that you would be able to join in with someone else. And no matter what, they want to hear from you. They want to hear from the pharmacists, very important profession right now in the scope of things going on in the world.
Perfect. And like Liz said, you'll likely be meeting in groups. And then just like other years, you're going to get the one pagers that have our talking points and kind of what you can, when you meet with your legislators, really the key points of the bill and why we like them or why we do not. In this case, in this year, a lot of the bills that we're going to focus on, we're actually in support of. And so it's really going to be why we think they're good for patient care and why we think they're good for, pharmacists, technicians, and just the practice of pharmacy in general. So if you remember from last year, there is a video that IPHA put together on the do's and don'ts. It's available in terms of when you're meeting with your legislator. We're not going to play that video this year, but the link is there if you want to pop in and get a refresher. It's kind of kind of the extreme take on both ends of really what you would not want to do with a legislator. And so if you'd like, go ahead and pop in there and you can watch that. In terms of when you meet with your legislators, and Liz, please fill in anywhere in here that you like. Obviously your goal is to be polite with them. If you are from their district or their area, please, let them know that I am one of your constituents. You don't need to start as a voter and a constituent. If you're a citizen of Illinois, they know, right? They know you're going to be a constituent of somebody and you can vote. Keep it really to the 5 issues. At least for these visits, we really want to focus on these 5 key pieces of legislation, or 4 pieces of legislation and 1 resolution. And you want to keep it brief. You want to keep it to probably a 10 to 15 or play it by ear with them. If they don't have the time, then play it by ear. And then also, I have trouble with this one. Allow them time to ask questions. You can't, you don't necessarily need to be the one that's talking the whole time. Present information and let them ask you questions.
And I'm going to jump in here. A couple things so I talk to legislators for a living. The first thing I would say is always remember they're just human beings. And the more kind of formal and prepared, they really just want to have a conversation with you. instead of you reading a prepared statement or something like that. Especially on Zooms, right? I mean, we're all doing this a little bit differently. We're not there in our suits and ties. We're kind of in either in our homes and our workplaces having these conversations. So just remember it's conversational, and let them talk. They are elected officials. Guess what? They love to speak. And so it's really something, it's a good way to make friends is to be a good listener to them. And the other thing is really to emphasize the keeping it brief. The one reason I really think legislators take my calls is because it's a very short call. I do not keep them on the phone so that they know the next time there is a big issue, they will pick up the phone from me because it's very shortened. What you guys are doing, I really want to stress this, is very, very important for the issues that we care about. You cannot just rely on the organizations that you belong to or the work that myself and the other contract lobbyists do in the Capitol. That is not enough. Successful organizations have grassroots individuals on the ground, bumping into people in the grocery store, at the ball games, saying hey to your legislators and saying, hey, there's a bill that I want to talk to you about, or introducing yourself as an active member of the association. Really, the way that works, the grassroots really is the key component to success in the State House. We are talking to legislators on all kinds of issues all day long. And so that personal touch, Tip O'Neill said all politics are local. It really is the case. And a lot of times when I bump into a legislator, they may say, Dale Fowler may say, hey, I bumped into Carrie Wiggins in El Dorado and she mentioned the white and brown bagging bill to me, and it's important to me. So something like that, that really is the full scope of why we are doing this today, is that we really need full engagement from the membership of our organizations, both.
Very similar, along those same lines, what Liz said, offer assistance in any healthcare issues that might come up in the future, right? You're talking with them about these 4 or 5 issues, but offering your help down the road. And again, remember, they're not all, actually, I don't know if any right now are healthcare, right? There's a few that are, one that's a nurse, I think, correct, Liz? Otherwise, most of the legislators are not in the medical field at all. And so they're not going to necessarily have that healthcare mindset. They're going to know something about it, don't get me wrong, but not to the level that we do. Also, unless they've sponsored the bill or they're directly involved in the bill, you can't assume they're familiar with the topic of the bill. You really need to introduce them to why it's important and what it really tries to do. And then obviously, be polite and thank them for their time when you're done. Even if you disagree, right? Again, your person who is opposed to the bill that you support right now in the future can be the person that's on the same side as you on another bill. So the last thing you want to do, right? You can differ in opinion, but you don't want to ruffle feathers too much or get angry, because that can work against you down the road.
And this isn't, the place to talk about the highly controversial issues, gun control or mask mandates or things like that. We're really there with the focus. That's a conversation you can always have with your legislator, outside of this. But I think that you want to really stay focused on the message, especially since we reached out on behalf of pharmacy organizations. We don't want to, do a side swipe with them if on other issues. So I would just say focus on the issues that we brought forth.
And Chris, before we go to the next slides and change the topics a little bit here, I just want to add, just remember, don't get frustrated, especially when it comes to understanding. Our issues are never simple, and healthcare issues are not always simple. And so this is really relationship building. And so this is going to be your first of many conversations. So especially when we start talking about, whether it's the PBM reform bill or even white bagging, brown bagging bill, None of the bills issue that we're talking about are really easy to get. They can run with it. They do require a lot of background, and it all depends on how much time they have and their understanding of healthcare. Some do have some experience in healthcare through their experience with the legislature or, in their jobs, but many of them do not. So you have to be patient with them. And again, as Chris said earlier, try to keep things as simple as possible and really helping drill it down. And always try to bring everything back to how it's impacting your patients, because that calculates to them as votes. So if they understand that this issue is beyond just our business practices and our practice settings, it also is impacting our patients directly. And always make sure to be talking about how it's impacting our patients, not only in access, but in the quality of the healthcare they're receiving.
So next, we're here to really talk about a lot of the legislation that has been proposed. And so we're going to get right into the bills. So Garth, I think the first one in terms of Senate Resolution 792 is you.
Yes, thank you, Chris. And SR 792, and before I go any further than that, for those of you who have been at previous legislative days, are probably confused, going, well, shouldn't that be SB? No, this is a resolution and not a bill. And so it works a little bit differently. In years past, we've talked about how the legislative process works, and we go through that in our law reviews and such as such. But a resolution is an enactment based on a specific topic, and it is a vehicle for the chambers to be able to make certain asks that don't require a permanent legislative solution. And so with that, it allows the Senate, and the House has this capability too, and they even have a joint resolutions policy. But the way this is set up, only one chamber has to approve it. So in this case, we're working on SR 792, looking at asking for an audit of the managed Medicaid program, specifically the pharmacy benefit. And so we need the senators to approve this in a majority. We don't need the House to approve it, and it doesn't have to be approved or vetoed by the governor for this to be enacted and move forward. A similar resolution on this area happened in 2017. The House passed a resolution that actually looked at the managed Medicaid program during its early pilot stages. And if you remember, we've talked about that audit report and shared that with legislators. Again, that showed the mismanagement of $7 billion at that time. And so, it's continued to bring additional heat onto the managed Medicaid program, but we've never looked at, from a state level, the true costs and how taxpayer dollars are actually moving into the managed Medicaid program. And it's causing a lot of, kind of people trying to say numbers are here. It's kind of like a he said, she said about where dollars are actually going through. And so we're asking the Auditor General to take a look at the program from HFS all the way down to how the reimbursement dollars are dispersed through the MCO, the health plan, to contracted PBMs, and then ultimately to the pharmacies. So this will help give us a true picture of what we already know and what has been proven in state after state after state that has looked at this, that pharmacies are majority under reimbursed and not significantly provided for in not only reimbursement for the product or in proper dispensing fees, which then gets us all the way back to the access issues. One of the things that we've been working on and sharing additional information to the Senate is on pharmacy deserts and how that has exploded since the managed Medicaid program has gone into effect. So this will help give us the true numbers we need to justify the data that we have provided in our anecdotal stories from the associations and from pharmacies and from members. So this did get heard in Senate Health Committee on yesterday. It did come out on a vote of 14-0. It is scheduled to be heard. Well, it's scheduled into the secretary's listing of resolutions for tomorrow. That means that tomorrow is the earliest day that it could be presented and voted on. That doesn't mean that's when it will be voted on. But I know that there's a lot of momentum. We've had a lot of conversations with Leader Kaler over the last 24 to 36 hours. So I think as the momentum's moving on the resolution right now, and that a lot of that is because of you. You guys filled out witness slips this past week, and I thank you for doing that. You kept on the calls and the emails through the Voter Voice app to sending messages, and we got additional co-sponsors on it today. So we just have to keep that pressure on until the resolution's passed. And we're very close on this. So we just got to keep it up for hopefully a little bit longer, and then we'll get this one on the line. So to be truthfully honest, we're not sure how this, we got a winter storm coming in, so things may get shortened severely tomorrow. But if they do meet tomorrow, this could get passed, and we may not need you to talk about this next week. So we will be updating these talking point sheets and updating what we need you to focus on as the week comes on, with what Friday and what Monday look like for everybody. So we can go ahead with the next one unless there's any questions from attendees on this. And I don't see anything in the chat or the questions. So. Chris, you may go ahead and start with this one.
Go ahead. Yep, go ahead.
Okay. So House Bill 4430 and Senate Bill 3209, and the primary vehicle that is starting to move right now is on the House side. And we're very glad to be working with Representative Cassidy and Senator Simmons on this legislation. This is, yes, Starla, we'll send an email update out to everybody on any updates on the bills prior to your meetings. So this bill is an initiative of the AIDS Foundation of Chicago. This started because of some legislation that we worked on late last spring as a kind of a Hail Mary at the end of session, trying to get additional provisions codified from COVID and also try to address other test to treat options. And HIV PrEP and PEP was part of that. It didn't make it, but it did start the conversations over the summer with the AIDS Foundation of Chicago. They were very favorable of working with pharmacy on the development of this legislation. I'm really proud to say that we're pretty much to an agreed bill at this stage. We went through the very hard discussions with the medical society because the original version of this language was looking at pharmacist prescribing. We knew that would have an immense pushback, even though we have to admit we're in a true paradigm shift now. Pharmacists are prescribers. The federal government has said that due to COVID. And how that looks is what we're going to have to work on now as we go here in the years forward. And so pharmacists being prescribers is a reality, and we just have to determine and define that. We did not get it with this. So we did have language that may have gotten us to some hybrid version of it, but legally it did not protect us enough to be able to move forward at this juncture. So we are keeping it into a standing order situation, which puts it very similar to last year's bill on contraceptive services. So the pharmacist will be able to initiate and administer medications, be able to, under a standing order, refer patients to receive appropriate laboratory tests, and for the assessment and referrals and providing HIV PrEP and PEP. Of course, we've worked on the insurance part of this, which is the major component as we continue to build this ever growing foundation for pharmacist care services on the medical side. And remember, this is going to be built on the medical benefit. And so we're going to be working with all of you over this next year as we go through credentialing, working with you on how to properly bill, how to properly document. And it's a lot different than what we handle through traditional dispensing or working through the PBMs. That will only be for the medications. We're healthcare providers, we're providing professional service, and that gets billed through the medical benefit. And so this bill would be guaranteeing that we wouldn't be reimbursed at any level less than 85% of what the physician fee schedule is. And that's actually the same rate that physician's assistants and nurse practitioners receive for providing services. So And we would also be providing these services in accordance with current guidelines. And so, and this would also cover on both Medicaid and for commercial insurance. So we've got some clarification language, I know, from the department that we're working on right now. LRB is backed up, Legislative Reference Bureau is backed up right now severely. We were hoping the amendment could have gone through healthcare licenses today in the House, but it did move through committee and we'll come back with the amendment next week. So we will want you to be talking about this bill to help build support. It was really positive that both the bill did get pushed out by an 8-0 vote. So both parties were in support of the bill moving forward. That was a very good sign, even though it was early discussions. We didn't get into the meat and potatoes of the bill in this committee hearing today. So it's very positive. Hopefully we'll continue to have that bipartisan support as we move forward. We know some legislators will have questions, but this is really a good bill that's building on the success and modeling after what we built last year with House Bill 135 on contraception.
And I think that's another important, since we talked about House Bill 135, there's nothing that would require a pharmacist for participating either. So very similar, right? And I think one of the other things to consider with this is it's an increased scope of practice, right? And access to patients or through the pharmacists, or access to care, I should say, through pharmacists. But we also, the balancing act is going to be, we're already doing a lot of other things, and how do we incorporate this in and operationalize it as well? But anything that allows pharmacists to expand their scope of practice and provide better patient access to care is a good thing.
Absolutely right. And I see we had a couple of comments. Starlet said there's no easy button for full documentation. I agree with that. It's going to be a learning scale for a lot of us as we get used to this. Richard, in the chat, you're talking about House Bill 4051 on provider status. I think that's on a federal level, if I'm not mistaken, and a lot of the federal legislation in that area is not moving at this time. Good questions.
So the next bill that we wanted to talk about was House Bill 4595, which is Representative Harris introduced it, and it really revolves around 340B drug discount program protections. This is a bill that actually we're working on. We're collaborating with a lot of other organizations on. ICHP, IPHA are obviously on board. There's the Hospital Association, as well as, the FQHC organization, Liz, and I can't think of the acronym right now.
Illinois Primary Healthcare Association.
Thank you.
The one where Director Treto was, Secretary Treto was the president of Howard Brown was the FQHC. Yep.
So really what this is, I guess, maybe not everybody on the call knows what 340B is. It's a federal program that allows certain organizations, or what are called covered entities, to get access to drugs at a discounted price. And the goal of it is to help spread scarce federal resources, right? And to allow those scarce federal resources to be spread more widely, or more money. And so what's happening though in the 340B realm is, I'm sure many of you are aware, there's been changes to contract pharmacies and what contract pharmacies can be included, changes in terms of what drugs are covered, and that drug can only be given or dispensed from one contract pharmacy. The other thing that's been thrown out there is third-party payers have been discussing, are there ways that, similar to what Medicare is doing, where Medicare, based on a modifier being applied, you would get a lower reimbursement from commercial insurers for 340B drug. So really what this bill looks to do is to ensure that 340B covered entities would not be able to be put at a disadvantage with respect to what they get paid, right? So parity in terms of reimbursement, that those limitations in terms of who can be included, that if a contract pharmacy and a covered entity, if their arrangement meets the HRSA definition, they would be allowed. And so it also looks at some of, that it wouldn't impose any fee, chargeback, or rate adjustment that's not imposed on another pharmacy that isn't 340B. So really to try to keep that in parity, and trying to also prevent or interfering with an individual's choice to receive that prescription drug from a 340B covered entity or that, that pharmacy. In terms of other things it would really do, it really just, again, I'm trying to think of other aspects, but it really tries to prevent those insurance companies and others and the PBMs from being able to use the fact that you're a 340B entity to reduce payment, decrease access, or dictate what pharmacies can fill those prescriptions. And I don't know, Garth, what you would add to that.
I think what I would add is, we're hoping this bill does continue to move forward. It does have some momentum, but it is snagging and dragging on a couple of sections. And one of them is at number 6 that's here on the slide is on the billing modifier. There seems to be a lot of consensus on other parts of the bill, a majority of the bill, and this seems to be one of the last sticking points. And we're hoping that there can be further negotiations to help move this forward. But what can be a great success in passing this type of legislation, particularly in how it brings parity and also puts in discrimination provisions or anti-discrimination provisions into the PBM section of the insurance code, which is what was established in 2019 with House Bill 465, which was our landmark PBM legislation. This would help set up a precedent and a further legislation, and including other legislations in our PBM reform bill in Senate Bill 2008, which we'll talk about here shortly, that it would already establish, if we're already establishing that 340B pharmacies should be able to have any willing provider protections, additional patient protections, and payment parity, that should be spread across the entire continuum of pharmacy in relationship with PBMs. So this is a good start to be able to help expand and create better success as we move forward. And unfortunately, right now, this bill is taking up a lot of the PBM discussion. And in some ways, rightfully so, in the 340B sector, it is very important. We want to make sure that there's a good bill, but I know we have initiatives of trying to move additional legislation. It's very complex in this shortened session, and that's what we'll be talking about here in a couple more minutes.
And I think, Starlin had said, it's important. It's important to highlight that, 340B covered entities, really it's in that, and that having that program in place is really about patient access and being able to, and I think it's Sandra Durley as well, right? It's access to care for those patients. It really helps provide resources to the disproportionate share hospitals, the children's hospitals, the FHQCs, those organizations that are under-resourced that basically depend on it to be able to provide care to their community. And then I think Starlin mentioned, right, that the vertical integration with PBMs and insurance and their specialty pharmacies really prevents access to those other pharmacies. And this does try to say, right, there needs to be parity and access as well. The other thing with one last quick thing with this, which this is kind of we think probably a moot point now, if there was discussion about requiring no modifiers at all. And if that was going to be the case, there was going to be some requirements potentially to consider retrospective reports coming back to the state, just to make sure that there weren't duplicate discounts in terms of the 340B program. But given that we've kind of shifted a little bit back towards the modifiers and how do we make those work, it's unlikely that the reporting would be required.
And you're right, Chris. Actually, in the Medicaid space, the billing modifier for Medicaid and this clearinghouse language is taken off the table by IPHA. So it's now just the billing modifier in the commercial space, which seems to be the last holdout. Now, continuing on talking about PBM reform, and I think you're going to see a coincidence of theme here with the last three bills that we've, the previous bill, this bill, and the next bill. Senate Bill 2008 on PBM reform being brought forward in the Senate by Senator Dave Taylor and in the House by Majority Leader Greg Harris. We're focusing still this session with the Senate vehicle, and right now it's in Senate Insurance Committee, particularly Amendment 3 is what we're focusing on. And this continues to build on the foundation, as I said earlier, from our 2019 bill on House Bill 465. It still is incorporating many of the components from a model bill that was created through NASPA, the National Alliance of State Pharmacy Associations, and NCPA. And this was in response to the successful Supreme Court ruling. I'd like to remind everyone that was 8-0. PBMs really lost this one with PCMA versus Rutledge. This is real. What we're continuing to build upon is trying to help with establishing a lot of the payment provisions and a lot of transparency and network access provisions that are in a lot of states that, quite frankly, in Illinois, we're trying to play catch up on. And it's just because we've finally been able to build consensus enough with legislators, or finally educated enough to work with us on this issue, but that doesn't mean it's an easy road. It's still an uphill climb. And so we would continue to be looking at removing PBMs from charging patients co-pays greater than the cost of their medication, expansion of the gag clause, looking at expanding any willing provider language, kind of tying back to the previous bill we were just talking about, and other discriminations of patients being able to use the pharmacy of their choice. But we're also looking at additional models that talk about PBM reform. And the National Association of Insurance Commissioners, with a lot of their work in tandem with NCPA, we've added language on fiduciary responsibility of PBMs in respect to how they treat patients, but also language on other prohibited practices, and trying to move away from patient steering, which continues to happen. And we'll talk about patient steering in the next bill, in particular with how patients are receiving some medications, but also making sure that we have data protections in there as well. And finally, the last component in the bill currently is on audit protections, which we've been working on. Last major effort was in 2018 with then Senator Kwame Rule, the now current Attorney General. So we've had a lot of things in our favor. As you know, I didn't mention under the resolution discussion, but we in October, the state of Illinois did settle with Centene, who runs the Meridian plan under Managed Medicaid, for $56 million. And that's 56 of almost $300 million that Centene has already paid out to 6 other states across the country. And they've put $1 billion back for other future settlements. That should concern everyone with a red flag. If you're not guilty, you don't put a fund back of taxpayers' money to help pay off settlements. But they're too busy also putting names on stadiums, as we saw yesterday in St. Louis. So, you know, it's trying to get PBMs to try to get back to their focus on what they need to be, which is a claims processor. And so we are continuing to work on this bill with everything with PBM legislation, with any legislation. A lot of times it becomes like a game of Jenga. You have multiple different strategies. You keep tapping on one of them until one of them starts to move. And that's what we're continuing to work on right now, where we're continuing to work with stakeholders to try to clear up any additional language so we can try to see if we can move a massive bill. That's one thing about this PBM reform bill. We still have to play a lot of catch up from some other states. And so this bill is very massive to move forward, even though we've trimmed a lot in some very important parts away from this bill in trying to model it for success for this year. But it's still a mammoth bill to move forward, and that doesn't make it an easy effort. Just as an example, we were working with the HIV bill, and if things would not have gotten very cooperative with the Med Society, that bill was coming to a screeching halt very quickly. So it's not taking a lot this session for bills to get the door slammed on them, unlike it would be under normal situations in other session years. So we're continuing to put all efforts into this to continue to move this forward, and we'll be providing additional updates for you to be talking with the legislators as we go forward, in particularly sharing information from an NCPA study that shows that states that have PBM reforms actually have a lower cost of premium to the patients, which goes against everything PCMA is saying, because they keep saying that our legislation of trying to provide greater access and sustainability in pharmacy practice, which is actually more of an allocation of the dollars already spent, would cost $1 billion. And it just makes me laugh thinking of how stupid and Dr. Evilish they sound every time they say that, which is also another reason why we need the data from the audit, to be able to show how silly and stupid they're talking about, and really, at the end of the day, how criminal they are in their actions in subverting pharmacies and pharmacists from doing what we're trained to do and what we took an oath to do, and that's take care of our patients. And we see how these practices have been continued to be abused as certain corporations continue to do cannibalistic marketing to destroy themselves for their bottom line. And that's what we have to stop, and we have to continue to push for, because this is not just for patient access and improving health outcomes, which is, this will help with doing that, but this will be with helping with for the utter survival of our profession. And that's why, even if we pass everything in 2008, we will have another PBM reform bill. This is an endless battle until we finally get something done on a federal level, which hopefully the FTC, as most of you know, is looking at this tomorrow and is going to be hopefully voting in favor of an investigation into PBMs, so that we can really see what's going on from a national perspective as well.
There's a few people who have said, yeah, yes, call them out, Garth. Dirty, rotten scoundrels. That's as polite as I can say it. So, and then, yeah, it's one of those things where looking at these practices and uncovering the, right, I think that's what we found is the legislators want the data, right? And I think if we have that data, like Garth said, from the audit that shows where the money goes, it's a great first start to be able to say, look, here it is. And it's, if it's objective information, then it's great.
There was a good question in the Q&A section from Justine about that had a question regarding the pharmacy profession's progression towards receiving provider status, considering all the progress we've made due to COVID. And this is where I'll say we're having better success right now on a state level. Now, granted, that's being hugely supported by what's going on during the pandemic. The federal government has recognized the ability, skill, and knowledge of a pharmacist by allowing us to prescribe and provide immunizations down to age 3, provide COVID testing, to provide COVID therapeutics, including monoclonal antibodies to patients. These efforts don't come by it just happens. This is by recognizing the value and skill of a provider. And we're hoping that this continues the conversations, and it has started a lot of conversations with federal government agencies on these very important issues. But as you have to remember, we throw around provider status as a very easy term. But remember, it's 3 major components: designation, which we've had in Illinois since the year 2000, that states that we're a healthcare provider and professional. Scope of practice, which is anytime we expand scope of practice. So last year we did that with contraceptive access. We've done it now we've modified late last spring with allowing pharmacists to be able to permanently immunize down to age 7 for all vaccines. And that will be once everything rolls back federally. And then lastly is payment and reimbursement remuneration. And that's the last component. And that's what we helped build that foundation last year with House Bill 135. I mean, we can allow you to do a lot of these things. And a lot of pharmacists have been providing patient and professional services, but it's been on a cash model. And that's an extremely uphill Mount Everest battle. And many have dedicated a lot of time and years to this. And we've been chipping away and chipping away and chipping away. But we finally got our foundation on a state level last year and got it under Medicaid as well. And that's where we have to build it until we can move that federal monolith right now on a federal provider status bill, because there's still a lot of major silo fighting going on, mainly from the American Medical Association, and a lot of, I think, false assumptions on what the true cost would be for pharmacists basically saving everyone in healthcare. It's like every time you allow us to do what we're trained to do, what happens? Two things. Patients' health outcomes always go up and healthcare costs always go down. And it's simple as that. You allow us to do our jobs and we can make everybody win.
You know, and Garth really highlighted the two fronts, right? One is the chipping away and just keep working and getting more. And, you know, if every win we get where we improve our scope of practice and we get paid for it, right? That's a key. That's a win. It may not be the whole thing that we're looking for, right? Yes, we want to be able to manage drugs and disease states to the fullest extent, but that's the whole thing. You know, and that's the Medicare discussion that he's talking about. And can we get the federal government and that legislation? So really, it's kind of pharmacy organizations and individuals are working on both sides of that equation. Take the wins on the state level that are disease state or, you know, topic by topic, but also try for the federal, you know, the big swing too. So, you know, they're both important, and getting gains obviously on the Medicare side would be huge. But the state wins are huge as well. They're very important in terms of showing what we can do and expanding and allowing us to set up systems for payment and reimbursement. And, you know, doing that in kind of a stepwise fashion is not all a bad thing. So we'll move on for the sake of time. You know, I know this is a bill that will interest a lot of health systems pharmacists, as well as a lot of our community pharmacists and independent owners potentially as well. You know, white bagging and brown bagging has become a bigger issue for a lot of health systems in Illinois. We're seeing a lot more third-party payers requiring these practices. And I think, you know, again, white bagging is, just for everybody on the call, since I know we have some students, is when insurance companies require a provider. That could be a hospital, a pharmacy, it could be an infusion pharmacy, or even like a rheumatology clinic, a physician-run clinic, when the insurance company requires that those providers don't get to buy the drug and bill for the drug to the insurance company. What has to happen with white bagging is a specialty pharmacy that's usually affiliated with the insurance company and the PBM is able to fill that drug. They ship it to the provider, and the provider is only able to bill for the administration of the drug. And it's a very small fee. And the issues with it is it really causes a lot of issues with continuity of care. There's a lot more effort that goes into coordinating the care because, you know, just from personal experience, the number of broken vials in a FedEx shipment that we've received, you know, when I was a pharmacy director, the vials freeze out on the dock in the middle of winter because they're delivered on a Saturday morning instead of Friday afternoon. You know, those kind of things. The safety protocols that are normally in place in terms of barcode scanning and all those kind of things. Storage of the drug becomes a big issue because it's patient-specific drug. Instead of having a non-patient specific supply, that drug that gets shipped to you is dedicated to that patient, and it's supposed to be stored until that patient comes in for their infusion. The other issues that come up, doses change. You know, chemotherapy, based on lab results, the therapy needs to be adjusted, and the product that you have shipped from the company or from the insurance company and from the specialty pharmacy doesn't meet that need, or you can't make that adjustment with it. So it really, you know, when you talk about ASHP, ICHP, and pharmacy organizations, we think it's a less safe process that really focuses on trying to save more money for the insurance companies. Brown bagging is even another step worse, in my opinion. Brown bagging is the drug has to be picked up by the patient at a pharmacy and then transported to the provider by the patient to be infused at, or administered, I should say, at the provider's site. So again, integrity of the drug becomes an even bigger question when a patient stores it for any amount of time and then you're going to, you know, infuse it. So what Senate Bill 3924 and what Senator Castro is really, what we're really trying to accomplish is that those types of requirements for white bagging and brown bagging cannot be forced upon providers. The argument always is that, well, these hospitals or these providers can always contract with the insurance companies and they can negotiate that, white bagging not be included. And the issue really is that they really don't have that negotiating power overall to be able to say, we're not going to do it. And there are a few big institutions that have said, we will not participate in white bagging or brown bagging. And if that's what the insurance company wants, then we will, the patients need to go elsewhere to get their product. Unfortunately, not all health systems and infusion centers are able to, to do that. So really what this bill would do, there's about 8 provisions that would really prohibit insurance companies from being able to require a provider that's going to administer a drug to participate in that white bagging and brown bagging process. There's other states that have, attempted. There's one state that has addressed this. There's a lot of other states that are also looking at prohibiting this practice. And so it really, we think it's a good change that will really improve patient care in Illinois. And also, what the analogy that it's been likened to on our government affairs calls at ICHP is, it's like you bringing the ingredients to the restaurant, telling the chef you're going to pay them, a very low fee. The chef has no control over the quality of the ingredients and how it gets put together. And then you say, you know what, I'm going to pay you $2 to, I should only pay you $2 to put together this meal, because, really the ingredients are what cost the money, and going that way. And so we're hopeful. We've got a meeting on Friday with Senator Castro to really talk through this and why this is important to health systems and to patients. I think that's the part I didn't talk about. The worst thing is when a patient comes to get their therapy, they're scheduled for Friday afternoon to get their infusion. They show up and you know what? FedEx didn't deliver the drug. So now the patient is expecting to get their, immunomodulator therapy, their monoclonal antibody, their cancer therapy, and they can't get it. And our response is, it didn't come from the specialty pharmacy. We're sorry, we're going to have to reschedule for next week. That's not good for patient care, number one, but also from a people's life standpoint. They plan their life around being able to come in for those infusions, and then they come on in on a Friday and their drug doesn't show up. So it really just is not good for patient care. I don't know, Garth, if there's, I talked a lot there, if there's anything you want to add to it.
No, I think it just gets down to a lot of the issues that we continue to come back to time and time again, that the PBMs are not caring about the outcomes of the patient. It's about what happens to their bottom line. And this is really, they're against this for one reason. They want to make sure that everything goes through the specialty pharmacies they own, and not be as what's convenient, and sometimes in a lot of ways more cost effective for the patient to receive these medications locally, and to make sure that they're done in a way that's safe for the patient as well.
Yeah, absolutely. And and some great comments in the audience. It violates the Drug Supply Security Chain Act. Track and trace, same kind of a thing. What if the patient, some people have had patients show up and say, oh, I left the drug at home. So they come all the way into, their academic medical center downtown and they didn't bring their drug. And so then again, an issue. Another insurance company move. And then, Justine asked, with brown bagging, is there any process to test the integrity of the drug? There really isn't, other than visual inspection. If you obviously saw a particulate in it, or there was some indication visibly that there was something wrong with it, or if through a patient history, if you found out they, in the middle of July, they stored it in their glove compartment or something, if they give you that information, you might be able to find a problem. But that's why we feel like that, the supply chain and the, the custody of the drug is really at risk in both of these settings. But, I think to an even higher degree when it comes to brown bagging. Yep, and that's Heather Jarvis just said, brown bagging has a lot of chain custody issues as well. 100%. Other questions? We know we're a little bit over time here by 15 minutes, so I want to be respectful for everybody's time. Does anybody have any other questions on the legislation? Because what we'll do is we'll have a couple of next steps and then we'll wrap up for the evening. Starlin just said totally against the purpose of the Pharmacy Practice Act to protect the public. 100% agree. So we've gone over the 4 bills and the 1 Senate resolution to make sure that you're kind of up to speed on these. What I can tell you is Garth and I are following over 100 bills. There's 100 different bills that affect healthcare. These are just 4 bills that we thought were really important to the practice of pharmacy and for patient care. And so for our technicians, our pharmacists, and our patients, these are the bills that we thought were good to focus on. What you're going to get is a 1-page summary, of the key points that are going to be coming to you on each of these bills. If there is an update, like Garth said, we're going to meet with Senator Castro on Friday to talk about white bagging and the bill. Where it goes from there, that could affect what we have you talk about next week. So those sheets will be coming, but we have to make sure they're timely and they have the right information in them. So you'll be getting those. In addition, you'll be getting meeting invites for your actual meetings with the representatives and senators. And with the way that it works, just like what Liz said, with how busy they are right now, we're going to get them when they're available. Do what you can to make the meeting, but it may not be perfect for your schedule, but we're really we have to base it on when the legislators are available to meet. And so what we would like, we hope that we can get 3 or 4 pharmacists and techs and students to meet with those legislators to talk about these issues. Our goal is obviously to get the Zoom meeting links out. So it'll be a Zoom meeting with the legislator that we'll send you the link for it. We'll make sure to send emails out as well as have some social media posts that start going out too to highlight those bills and the important issues. And again, just like I said, please do your best to attend it. If you can't attend it, let me know and we'll see, what we can do. I want to make sure we have at least, 3 people show up to each of these meetings to meet with the legislators. So if you can't meet, don't worry, I understand. You've all got jobs that you're doing and sometimes the job's going to conflict. But let us know so that way we can ensure that we have the right people around the table and enough people around the table to meet with those legislators. And, and with that, like I said, we're already 15 minutes over. Got Garth's email and his phone number, as well as my email and phone. And if you have any questions in the meantime, day of the meeting, there's an issue, you can text me, call me, and we can try to, help resolve any issues that come up.
Absolutely. We're here to help because we want to make sure you have a successful meeting this next week.
Are there any other questions on any of the legislation or about legislative day and how it's going to work? All right, I'm not seeing it. Thank you everyone. We really appreciate the time. Individuals being involved in advocacy is the key to success. If you have the lobbyists, right? The lobbyists with the organization and the individuals working together towards a common goal, that's when you're going to be the most successful. So we really do need you to meet with your legislators to really inform them of why this is important to pharmacy. So with that, just thank you, everyone. Have a great evening. And Garth, I don't know if you have anything you want to say, final words?
No, just please work with us as be flexible with us as we work on getting these appointments and have a great meeting. And again, if you review these talking point sheets when we get them out to you, please feel free to reach out to us. We want to make sure you're ready to go so it can have the best impact for us this next week. And Starlin said patient stories. Absolutely. Patient stories. Definitely. Make
Yep.
sure to talk about your patients.
The story that, I think it was, I can't remember who it was that talked about the patient who left their med at home in brown bagging is a great story. That emphasizes how it goes wrong. That doesn't happen when it comes from the pharmacy. So from the, the infusion pharmacy. All right. Well, thank you, everyone. Have a great night and good luck and have fun in meeting with all your legislators.
Good night, everyone.